So we are live now.
Okay.
So good evening one and all, and welcome to yet another chapter of Coffee or Critical Cases. And today we have Dr. Kunal Choudhary with us, and he's going to share the insights about ascorbic acid and thiamine as an adjunctive therapy in critically ill patients. So without the further ado, let's dive into the conversation. Welcome to this forum, and over to you.
Thank you. Thank you, Mr. Gaurav. And a very good evening to everybody. And I would like to thank you all for joining us here. More so because we are doing that on a Saturday evening, because after a weeks of hard work, probably sitting again for a academic session. So for that, I would like to thank every one of you. And I would like to keep it as interesting and not to bore you with many of the datas, but yeah, I'll just touch the relevant topics. Now, ascorbic acid and thiamine, these both are actually forms of vitamin. Now, vitamins have gone through, a full circle uh, in its application in the medical field. Because in starting, it was shown that vitamin can be beneficial for critical patient, for non-critical patient, for many non-specific diseases like, or maybe I will not say it was shown, it was assumed based on the experience, based on the logic. It was assumed that they are very mm, they are very helpful in a wide array of diseases. So it was the prescription was started very generally, I would say. I mean, for each and every disease, there was a time when a vitamin was prescribed, and it was thought that it would lift up the general immunity, the general well-being of the patient, and would probably benefit in apparently all the diseases. But after a few years, many of the vitamins actually failed to prove evidence regarding their efficacy in general health, general immunity. So then, as per the evidence, the usage decreased. But as the critical patients, the critical load in the developed and developing countries started to increase, probably because of better healthcare facilities, probably because more people were going into old age, they were living up to old age, and obviously old people had higher chances of cancer. So all these lead to more critical care patients. So when that came the era of antibiotics. Now and after after a brief some period of modern antibiotics, the resistance emerged. And at that moment, there was a very dire need to study these so-called not so useful molecules, the vitamins, and uh, just to find their efficacy. And why again a rekindled hope for this? Because if we go to our basic physiology or biochemistry, we'll see that they are cofactor and coenzymes in many of the reactions. And one of the main reaction is antioxidation. And antioxidation has been proven to be beneficial to, if not slow down, the optimize the aging process, optimize the cardiovascular morbidity, the risk factor, and even a cancer development. So then these two vitamins have been studied extensively in recent time. Can you go to the next slide, please? Yeah. So these were used in adjunctive therapy. So what is the adjunctive therapy? It is basically you can say that a concurrent medicine. If there's any colleague of mine from onco field, they will probably relate to it, where we use concurrent term very frequently in cancer medicine. So adjunctive therapy is basically a clinical intervention or a drug, which is also a form of clinical intervention actually, used together with the primary treatment. The primary treatment, I'll give you an example. Suppose there's a critically ill patient. We are going along, we are giving there's a sepsis patient. We are giving drugs to control the sepsis, that is the antibiotics, maybe fluid resuscitation, maybe inotropes. These are the primary treatment. Now now vitamins can you just move the slide a bit? The page, the display is not proper. The few of the words are cut. See the left-hand corner? Left-hand margin. Yeah, perfect. Thank you. So So these are used along with it to increase the efficacy, or maybe to uh, slow down the deleterious process, which is actually causing all the symptoms and leading the patient to irreversible damage. So other word, as I told you, can be concurrent medicine, adjuvant care, or augmentation therapy. Again, an adjuvant therapy is a very common term used in oncology. Same, like it is not the primary treatment, but it helps in treatment. It maybe reduces the side effect of the primary treatment sometimes, because if it decreases the required dose of primary treatment, ultimately the side effect decreases. And so as I told, it can be used to enhance treatment effectiveness. It purpose to increase the benefit of the initial treatment of a disorder by prescribing additional medication or treatment. As I told you, vitamins, it not only helps in treatment, but it also helps in in the near future that we'll be just giving vitamins to treat a sepsis patient or critically ill patient. It is an always an additional medication. Next slide, please. Uh, yeah. So, what are the benefits of adding an adjuvant treatment? It decreases the mortality. It has been proven. It's not just a hypothesis. It has been proven in few cases, though the jury is still out. But to a large extent, we have seen that it decreases the mortality, reduces ICU or hospital stay, decreases the morbidity, not only the mortality, reduces need for vasopressor support, that is the inotrope support, reduces risk of AKI, one of the major cause of mortality and morbidity in ICU or critically ill patient, and it improves lung function. Again, one of the major cause lung function is ultimately the failure of the proper lung function is one of the most common cause of death in critically ill patient. So it improves lung function and decreases chances of decreased lung function induced complications like pneumonia or maybe effusion, aspiration, those things. Next slide, please. Okay. So these are the two vitamins that we are talking about today: ascorbic acid and thiamine, commonly known as vitamin C and vitamin B1. Now, ascorbic acid, vitamin C is uh, known to act as an antioxidant and anti-inflammatory, causes the correction of the cellular functions, and it increases the microcirculation. Decrease in microcirculation, that is tissue level hypoxia, is one of the major, again one of the major cause of uh, multi-organ dysfunction and ultimately irreversible damage in critically ill patient. Now, many of the people who are right now active in critical care patient care must be knowing that lactate level is very important in critically ill patient, and increased lactate level uh, points to a deleterious course of the disease. Now, this lactate level actually denotes what is a tissue level hypoxia, and that is decreased by improved microcirculation, which is caused by vitamin C. Now, thiamine reduces organ dysfunction. Again, as I said, MODS, multi-organ dysfunction syndrome, is one of the major cause of death. So it reduces organ dysfunction. Important for antioxidant pathway. As I told, these are coenzymes and cofactors in many of the important pathways of the body, and it has a synergistic effect with the ascorbic acid. And yeah, safety record, though we haven't studied the efficacy as such, but for one thing we don't have a doubt, we have been using this for many days. We had very large data, and it has shown to be safe. Next slide, please. Now, various meta-analysis has been performed. Now, what is a meta-analysis? Meta-analysis is basically, it is in one line if I say, it is not a study per se. It does not study in the sense, there is no clinical study in a meta-analysis. Clinical study, meta-analysis per se does not mean it combines many studies. It could be RCT, preferably a randomized control trial, or maybe different type of studies on a particular topic. Like suppose I have to see today that what is the role of CEA in diagnosis of colonic cancer. So what I can do in another way is I can take various studies, I can compare their result, and based on that result, I can come to a conclusion, and that is meta-analysis. That is actually considered the pinnacle of the statistical analysis. So meta-analysis is ideally performed when there are multiple scientific studies, as I said, addressing the same question, which each individual study determine overall trends. And a summation of this is given by meta-analysis. Next slide, please. Now, there have been many meta-analyses on these vitamins and their uses. One of them is vitamin C administration critically ill patient, a summary of recent meta-analysis. Please come to the next slide. I'll show you the table. Please come to the next slide. Yeah. So I don't think much of them will be visible, but yeah. So you can see, I'm not going into detail of all these studies, but you can see there are multiple studies which are shown here. The whole page is not visible. Is it my problem, or this whole page is? Yes. No, the next one. Yes. No, 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 no. Can you go back, please? You have skipped. Yes. Yes. So now you can see on the first column, there's a publication details. That's how generally a meta-analysis is read. There are number of publications which they have studied, and then there's a title, what is the particular study about. Then there's selection criteria, which actually can vary. If you can see here, there are few study where the selection criteria is, there are different groups. The first one, if you see, adult critically ill patient, then there's a one which received vitamin C, which another one which received placebo. So there are different selection criteria. And then what are the they have also, what are the studies that are included in these meta-analysis? Like the first one, if you see, Pudzu et al., it included 44 RCTs, in which 16 were in ICU setting and 28 in cardiac setting. Not necessarily ICU or cardiac care, but yeah, it was in ICU setting. Can I have the full page again, please? And then there are subgroup analysis, which actually I will not go into detail. And then there are findings. Just have a rough look at the finding. Where there's a cross, that means there's no significant difference. But you see the first one, where the cardiac surgery, there's decreased post-operative AF, decreased ICU and hospital stay, average days of stay, the LOS, length of stay. And then if you come to the second study, which was actually Wong et al., it included sepsis and burn patients. Here there is a decreased mortality when the dose is 3 to 10 gram. I'm just putting emphasis on the fact which actually we'll use later to come to a conclusion. There was no decrease in mortality when it was less than 3 gram or more than 10 gram per day. So 3 to 10 gram is the ideal dose, because more than that you are not adding any benefit, and less than 3 is actually not beneficial. Then there was decreased duration of vasopressor support, which actually that means and then there was no effect on AKI or ICU or hospital stay, fluid replacement, or urine output. Now, if you come to a third one, there is again a decreased ICU stay. There is decreased duration of mechanical ventilation, which will obviously lead to less of pulmonary complications. Can we have the next slide? Now, effect of thiamine supplementation in critically ill patient. Again, a systematic review and a meta-analysis. Next slide, please. Now, these are very recent studies. As I told you, till recently, it was thought that vitamins cannot be thought of beneficial in critically ill patient, but studies ranging from 2017, 18, if you see the first study that is mentioned, that is Moskami et al., that is around 2020. Okay. So in these all, you can see the duration in days of the stay. These all have been, if you go into the detail, I'm not going into the detail. The mortality, few studies have shown that it has decreased, few have shown there's no change. And then in few hospital stay, hospital free day, ventilation free day, these all were significantly reduced in cases where thiamine was used. Next slide, please. Now, so what is the dose? Because as I told you, I gave you an example that one of the, it was seen that less than 3 is not beneficial and more than 10 is again not beneficial, and probably it will add to vitamin C toxicity. So the recommended dose in critically ill patient based on all the meta-analysis is, and okay, I'll just put emphasis on one more line, that intravenous of administration of vitamin C in combination with thiamine, that's okay, and hydrocortisone. Please note, it was shown before, it was thought before that a patient with sepsis or critically ill patient, uh, administration of steroids will be deleterious. But it has been proven that hydrocortisone or steroids, when used judiciously, actually improves the outcome in patients with sepsis or critically ill patient. Why I'm saying sepsis more instead of critical ill patient? Because sorry, I'm a surgeon, so most of my critical ill patients are actually because of maybe pre-op or post-op sepsis. So it was shown that in intravenous administration of vitamin C, that is 6 gram per day. Now it has been used in various ways. A few studies have used it as 1.5 gram every 6 hourly. Few studies have used 3 gram 12 hourly. Both can be used. Both have been shown to be beneficial, but it should be around 6 gram per day. And thiamine dose was 200 milligram every 12 hourly. So this has been proved, it was shown that it would improve the outcome of patient with sepsis and also decreases the mortality. Next slide, please. So now just summarize what I have gone through. Just see the summary of it. The meta-analysis reveals a positive correlation between incorporating vitamin C in the treatment of sepsis and favorable patient outcome, including better survival and shorter duration of inotrope use. So we can say that is an effective adjuvant therapy for treatment of every critically ill patient. And what all has been proven till now that it causes, it decreases the duration of AKI and inotrope support, decreases our the fluid requirement, which obviously, which again will lead to a decrease and increases the urine output. Next slide, please. So what are the again the perks? It's almost a repetition: decreased ICU stay, decreased duration of mechanical ventilation. It decreases the mortality, as I said, in doses of 3 to 10 gram per day. Decreases the morbidity, which actually is an indirect implication of all the improvements: increase output, decrease fluid intake, decrease fluid requirement. These would lead to obviously decrease morbidity, decrease need of inotrope, decrease AKI, and decrease fluid replacement. Next slide, please. Now, thiamine also have discussed, as I said in the previous slide, that days of mechanical ventilation was seen to be reduced when thiamine was used as adjuvant therapy. There was decreased hospital length of stay, decreased length of ICU stay, not only the hospital, even the ICU stay was decreased. And there was, I think there's a repetition. Okay, next slide, please. Thank you. Thanks a lot. I'd like to thank again all the viewers and also the Poland Healthcare, which has given me an opportunity to touch on a very unexplored topic, but I think should be a very upcoming topic, because all the person who has been with me, who has been treating critically care patient will agree with me, I guess, that slowly but surely in many patients we are running out of options, because the incidence of antibiotic resistance is rising, so we are running out of options. So these can really be life saving. Probably few more studies are required to make a practice changing shift, but obviously that day is coming for sure. Thank you.
So now the forum is open for the Q&A. If you have any doubts regarding the said topic, you can unmute yourself and ask the question, or can drop the question in chat box. So sir can address couple of questions. So I guess we have a question in chat box.
Okay, I'm just trying to actually open the chat box. I can see there's a question. It's showing one, but I cannot get to the chat box actually. Yeah. I sorry. I think I'm still waiting. Yeah. Mr. Avik Mukherjee has posted something. I'm just waiting for the question, I guess. Hello.
The
Hello.
forum is open for Q&A. Even you all can unmute yourself and ask the question if you have.
Sir, good evening.
Yeah, good
Good evening,
evening.
sir. Good evening,
Good
sir. Sir, I'm calling from Kolkata. My name is Avik
Yeah.
Mukherjee. Sir,
Yeah.
in here I've met doctor. He told me in adjunct therapy, uses like ascorbic acid along with meropenem, is cost of therapy is very high. So he will not recommend ascorbic acid. So that kind of situation, how can I handle?
No, see, these things are still a challenge for us. When we discuss in a forum, actually, we don't discuss an important point, the cost implication. And as I said, that the Giro is still out there. We do not have anything, mm, you know, uh, any standard book which says without doubt that you can use it. Right now, we have few evidence which shows that, yeah, it is useful, but it is not strong enough to make a practice shift. So this is obviously an issue. But are you working in critical care?
Yes, sir. Yes, sir.
Okay, you are a doctor, right, Dr. Avik?
No, sir. I'm a medical representative
Okay,
at Poland Healthcare.
so okay, see, the thing is, this is a very tricky question for us, because even I have faced this issue myself. When I see that, will I add ascorbic acid to a patient, and I don't have a benefit? What I would suggest is the presentation which was there, it has got a very good meta-analysis. Take a printout of it, go to doctor and just tell him, sir, we already have a meta-analysis. And what I do with the patient, I can tell you. Whether a doctor will do it or not, I don't know. Whenever there is such a situation where I find the cost will be too high, I just go to the patient attendant, the family member, the party, and I talk to them. I tell them that there is you can say a sort of experimental drug which will not be harmful for your patient, but I don't know whether it will be beneficial or not. And in such case, what do you want? I'll tell you, even in poor patient, 90% patient will have said that, no, sir, you please go ahead and give the drug. They just want to know that there is no side effect and there is a chance that it might be beneficial. If a doctor takes out a bit of time and explain, 90% of my patients say, no, sir, please go ahead with that therapy. I just want to save my patient. But that has to be made clear. The problem arises when we do not communicate. We give them vitamin C, and suppose the patient, we could not revive the patient, and patient has not been counseled, then there might be a problem when if they are educated, they will see a medicine bill and they will think यार vitamin C दिया है, ये तो মনে হচ্ছে immunity দিয়েছে. So it's all about communication. I don't find this problem. And maybe 10% of patients tell me that, sir, I don't want to give it. It's okay, we'll not give that patient.
Actually,
Okay?
sir, it comes from buffer from doctor. Actually, he told me it's a COVID product. So,
No, actually, see, maybe COVID made it so.
hello.
Hello.
Hello, hello,
Hello.
hello, sir. Hello, sir.
Hello.
Hello,
Yeah.
hello.
Yeah.
Huh.
Yeah. Do you watch? Hello. Can you hear me?
Yes, sir.
Yeah. See, do you watch Netflix?
Yes, sir.
Yeah. So basically, Nawazuddin Siddiqui was made a star by Sacred Game. That doesn't mean that Nawazuddin Siddiqui was not an actor before that. He had many good movies before that. So vitamin C was made the star, I agree, because of COVID. It became a household name because of COVID. But vitamin C was there much before the COVID. And there were many studies which were done much before COVID, when we didn't even know that there's something called COVID-19 which will be coming here. That time also the studies were done. What I could suggest you is you have to go, you ask your team to collect those old meta-analysis, make a PDF file of it, and please the doctors, probably it will benefit
Okay. Sure, sir.
you. Okay, thank you.
Sure. Okay, thank you.
Yeah. Any more questions?
Thanks for beautiful example. I guess
Thank you.
you have cleared the doubts of almost all that were in the mind. So yes, if we have a couple of more questions that we can address, please you can ask.
Okay, I
Sir?
guess. Yeah.
Hello?
Yeah, please tell. Yeah.
Sir, what is the preferable dose, especially in case of sepsis?
In
Of
sepsis,
ascorbic acid?
the preferable dose is 3 gram per day. That comes out to be one. The best regimen would be the preferable dose should be 3 gram per day. If you ask me practically, as I shown you that it has been even 6 gram, up to 6 gram it has been given. So, but 1.3 gram Q12 hourly I use in sepsis.
Okay.
Hello.
Okay, sir. Okay. Thank you.
Hello.
Hello. Yes, I got it, sir.
Yeah. So, hello. Yeah. So actually, no.
Hello.
I just quote the official dose that is given. But 1.5 into 2, all the studies have shown 3 to 10 grams. So you are giving a minimum of 10 gram. A minimum of 3 gram of dose, and it is also cost effective for the patient, because a critically ill patient is probably getting meropenem, probably getting inotropes. So it's basically the middle path that I'm taking, because I have to sustain the treatment. It's no use giving vitamin C for one day and then the patient cannot afford. So I take a middle path. I generally give 3 gram per day along with antibiotics.
Sir, another thing is that, sir, how would like to see that our ascorbic acid that we are having the brand of Scorpio XT, we are the first company to come up with ascorbic acid with thiamine combination. How you would like to see this combination is effective, or plain ascorbic acid is much better than this combination from your point of view?
No, practically speaking, if you ask me, practically, I have just used as I have given more emphasis on vitamin C uses as of now. But if you see the data, I would prefer, because thiamine, as far as I know, correct me if I'm wrong, okay? Because I am not, मेरे को उतना cost का idea नहीं है. I don't think adding thiamine adds much to the cost, right? Hello.
Yes, sir. Yes, sir. Yes, sir.
Yeah, it doesn't add much to the cost, and the one of the main benefit that makes me want a thiamine with vitamin C is. Hello. Hello.
Hello.
Yeah, is this hello?
Yes, sir. Please tell
Yeah,
me.
is it? Yeah, yeah. So I would like thiamine to be added to vitamin C. One, it does not add much to the cost, and
Uh,
second, it has promisely shown that it decreases the incidence of organ dysfunction. You ask any doctor who works in critical care,
mhm,
organ dysfunction is almost like a death certificate for us. A patient of sepsis, if the organ
mhm.
dysfunction starts setting up, the mortality is very high. So trust me, even if there's a 1% chance of for a drug to, prevent that, I'll not take a risk and I'll go ahead and do it. So
Okay.
I would recommend thiamine given with vitamin C.
Okay. Thank you, sir.
Any more questions? Hello? Hello?
I
Hello?
guess you have addressed most of the questions.
Yeah,
Any other question?
I tried my
One last
best.
question, if we can take.
Yeah, sure. If anybody's there, I'll take one more question. No problem.
Yes, anyone? So there is a request in the chat box that if you can just emphasize on adjunctive therapy in Hindi, like in a simple language, what it is.
Okay. In Hindi, it will be Hindi. Yeah, that's good. Acha, adjuvant therapy or adjunctive therapy. Hello? Hello, मेरी आवाज आ रही है clearly?
Ah, sir, you're perfectly audible.
ओके, तो एडजुवेंट थेरेपी उस चीज को कहते हैं जो प्राइमरी ट्रीटमेंट नहीं होता है, बट अगर वो प्राइमरी ट्रीटमेंट के साथ दिया जाए तो उसमें एडवांटेज ये होता है कि कई बार प्राइमरी ट्रीटमेंट को के साइड इफेक्ट्स को वो कम करता है, क्योंकि प्राइमरी ड्रग के रिक्वायरमेंट को कम करता है। सेकेंडरी उसमें फायदा ये होता है कि आपको मतलब वो और बाकी actually I'm so used to presenting in English. Just give me a moment. I'll explain it to you. सो एडजुवेंट थेरेपी वो थेरेपी होती है जो हमेशा किसी और ड्रग के साथ जिसका कि ज्यादा बड़ा रोल होता है किसी भी बीमारी में, उसके साथ उसे चलाया जाए, और उसका काम मेन बीमारी को पूरी तरह से ठीक करना नहीं होता है, पर शरीर की इम्यूनिटी बढ़ाना आप कह सकते हो, या दूसरे ड्रग के साइड इफेक्ट को कम करना, उन सब में वो हेल्प करके करता है। मैं एक उदाहरण देके इसको समझा सकता हूँ। जैसे कि अगर किसी पेशेंट को मेरोपेनम एंटीबायोटिक दिया जा रहा है इन्फेक्शन के लिए, तो ये एडजुवेंट थेरेपी देके हम मेरोपेनम बंद नहीं कर सकते। हमारा मेन ट्रीटमेंट आज भी मेरोपेनम है, कल भी था और प्रोबेबली कल भी रहेगा। लेकिन अगर हम विटामिन सी यूज करते हैं, जिसे मैं एडजुवेंट कह रहा हूं बार बार, वो शायद मेरोपेनम को 7 दिन के बजाय 5 दिन में उसका काम हो जाए, क्योंकि वो बाकी चीजों में शरीर को हील करने में मदद करता है इम्यूनिटी बढ़ा के। तो दिस इज कॉल्ड एडजुवेंट थेरेपी। उसकी अपनी क्षमता नहीं है बीमारी को खत्म कर देने की, बट वो शरीर को सहायता देता है बीमारी से लड़ने की एक या दूसरे प्रकार से। I think I made it clear, or is there any more doubt about it?
Absolutely, sir. This was again a beautiful example.
Thank you.
Yeah, we got the reply also.
Yeah, I just got it.
Point is
Thanks a
nice.
lot. Redmi Note 9 Pro. Sorry, your name is not there. Thank you. I hope I've cleared all the doubt. And is there any more question? I think we can.
I guess, so you have cleared all the doubts and concerns that were there, centered around the adjunct therapy of ascorbic acid and thiamine as a combination. It was indeed a wonderful, dialogue that we had. Thanks for your insights and thanks for your valuable time. To all the participants, if there are any concerns, we will share the sir's email ID in the description of the stream. You can directly connect with sir any at any point of time. And if required, we can have a couple of more sessions aligned to this particular session. So thank you, sir. Thanks for your time and thanks for the insights.
You're most welcome. Most welcome. Thanks for your kind words. I hope to get associated soon if such opportunity comes. Thank you.
Sure, sir. Thank you, and thanks for all the
Thank you, sir.
participants
Thank
for
you.
your valuable time.
I'll leave the session now if you don't mind.
Sure, sir.
Okay.
So, yes,
Thank you, everybody. Bye. Happy weekend. Bye.
Thank you, sir. Thank you, sir.
Thank you, sir. Bye, sir.
Thank you, sir.
Thank you
Thank you.
all.
Okay,
Thanks
you're
for your
welcome.
participation and thanks to sir again.
Thank you, sir.
for the insights. And with this, we mark the end of this session. So until next time, from Team Colon Healthcare, take care.